This is really a very challenging time when it comes to the management of multiple myeloma patient during this COVID-19 outbreak. I think, first of all, we need to acknowledge, unfortunately, that the myeloma patients are part of the so-called highly vulnerable group of people who are at higher risk of getting the COVID-19 infection. And this can be explained by several factors. Myeloma by itself as a disease usually induces a very low level of immunity. And we know in general, outside the COVID-19 problem, that myeloma patients usually have a very high risk of infectious complications, especially pneumonia. Now, when we look to the different treatments given to multiple myeloma patients, well, actually, almost all of these treatments include the use of high-dose dexamethasone. And dexamethasone is a major risk factor for infectious complications. And actually, it has been shown in the context of the COVID-19 infection that high-dose steroids are really a major risk factor for a negative outcome when it comes to the COVID-19 infected patient in the general population. And there is another factor which, in my opinion, makes the myeloma patient vulnerable to COVID-19 is about the patients themselves. The median age of myeloma patient is usually above 70. And some of these patients have some comorbidities, diabetes, hypertension, cardiovascular problems, and so on. And it is now known, based on the large series from China, from Italy, that age by itself and these comorbidities like diabetes, hypertension, or obesity in some patients are risk factors for COVID-19 severe infection. So when you put all this together, actually, you have all the ingredients for some severe forms of COVID-19 infection in myeloma patients. So with this background, I think we absolutely need to protect these patient against the infection. But at the same time, this should not come at any price, because we have also to pay attention to the treatment of myeloma by itself, because obviously we don't want them to relapse during this COVID-19 outbreak. So how to protect them? I think, first of all, and this is extremely important, because we do not have any prophylactic measures against the COVID-19 infection, it's extremely important to follow the rules about strict confinement, about hand washing, about avoiding children and sick people, but also those people who are suspected to be whatever infected. Also, social distancing in general is very important. It's extremely important in the overall population. I would say we should give it an additional higher level of caution when it comes to the myeloma patient and the hematology patient in general. But myeloma patients are really very vulnerable. So I think these general rules about confinement, about social distancing should be applied in a very stringent manner in this population. Now, when it comes to the treatments, actually, the patient, the physician should be aware of the fact that the virus doesn't circulate alone. We are, as humans and the patient are the vehicles of the virus. So one major goal is to avoid any circulation. So you need to minimize the visits to the hospital for the patient. And we know myeloma patients are usually treated on an ambulatory basis, and they come frequently to the hospital. So this should be minimized. And there are several ways of minimizing this. For instance, clinical research protocols, if they're not bringing a vital drug, they should be put on standby, or alternative solutions should be implemented by delivering drugs at home to the patient, by follow-up using telemedicine. And actually, by the way, we should really promote the use of telemedicine in these patients, and then you can nicely avoid the use, the circulation. If they need to come to the hospital, we have ways to minimize this. For instance, the twice-weekly infusions of carfilzomib can be switched to once weekly. We know that that is working, and it doesn't do any harm. And there are some drugs that can be administered at home. Bortezomib subcut can be delivered at home. Whenever possible, we should be able to switch to oral combinations. And we do have drugs, lenalidomide, pomalidomide, the IMiDs in general are good oral anti-myeloma drugs. Proteasome inhibitors like ixazomib are oral drugs. So we can, and we should not forget cyclophosphamide. Oral cyclophosphamide is absolutely effective in myeloma. So we do have already oral combinations that can be highly effective. Now, what about the transplant procedures, the auto-transplant procedure? Well, because of the need of hospitalization, because of the risk of complications, in a time where intensive care units are overwhelmed with the COVID-19 positive patient, we would like to minimize the need for intensive care. This is why I think it would be wise and reasonable to delay an auto-transplant procedure in these patients. And actually that can be done without any harm to the overall outcome of the patient. If you add another one or two cycles of induction, like VRD or VCD or VTD, but namely VRD, for instance, because we have a randomized trial, the IFM 2009 trial could show that VRD induction auto-transplant maintenance gives you a similar overall survival to VRD 8 cycles and maintenance. So definitely, we do have plenty of small ways to adjust and minimize the risk for the patient. And last but not least, as I mentioned in my introduction, the issue of dexamethasone. So definitely we need to minimize this dexamethasone dosage. So in those patients receiving 40, I think moving to 20 milligram of dexamethasone can be sufficient. Whenever possible, we have to reduce it or even discontinue it. I think skipping dexamethasone in one cycle, especially if you have a patient who is responding, he is in VGPR or CR, will not do any harm. So we really need to put all efforts trying to just go through smoothly through these 3-4 weeks of, I would say, danger zone. And with this, hopefully, I think patient will do well. From a psychological standpoint, it can be very hard, but we have to make choices, and it's a very temporary crisis, and hopefully we will make it all together. But definitely we need to pay attention and need to find solutions. These are extraordinary circumstances, and you need to put in place extraordinary solutions, in my opinion.